Project Agency, and as a professor in computer science at Carnegie Mellon University. Please join me in welcoming Gail and Peter to the stage.
Wow, it's incredibly exciting to be here and really an honor to share the stage with you, Gail. As we just heard, one of the most powerful business leaders in the country and certainly, of course, doing some of the most important work. Maybe we should just start by quickly introducing ourselves. As you just heard, I'm Peter Lee and I lead research at Microsoft. I've been there for 13 years, although I had a 4.5-year stint. At first I thought Satya Nadella, our CEO, was sending me to purgatory to reimagine our healthcare technology business at Microsoft. And so that ended up actually being a real gift and has brought me into this space. Gail?
Great, well, it's fantastic to share the stage with you, Peter. We had the pleasure of actually having you join our leadership group at our summit most recently, and it was absolutely invigorating for our leaders. Gail Boudreaux, CEO and President of Elevance Health. You heard a little bit about what we are trying to do there, but I always love to start with our purpose, which is very different than you would think of from a company that started its history in the benefit space, and that's to improve the health of humanity. And our goal there, and we're going to talk a lot about this, how exciting it is, and sort of the point of transformation that we're at, which is to really become a trusted lifetime health partner for individuals. And I think we have an incredible opportunity where we are now in terms of both the progress we're making around scale and data and new technologies to really change how healthcare is. So I'm looking forward to our conversation.
Yeah, so in fact, we were having a great conversation just in the backstage there, and we got into so many topics, so let's try to get through as many of them as we can here. And maybe a good place to start is with data, because maybe for the past 2 decades, the digitization of healthcare and health data has been, I think, an underappreciated thing. Of course, we all want more value out of data. We want decisions and insights to be data-driven. But we forget sometimes just how much has gone digital. And so at Elevance, what is your view of the value of health data and what is Elevance doing today in the data-driven insights?
Yeah, well, I think you heard in the introduction, we serve over 117 million consumers, all in the United States. And data is hugely important. Sort of data is the fabric of how we actually make progress. But I want to go back to, before we talk about data, which is personalization. Because I think for us, data is about a couple of things. It's about like improving the consumer journey, personalizing healthcare, which is an incredibly difficult journey right now. It's secondarily about improving the healthcare system. So how do we improve clinical interactions and use that data to also make it simpler in terms of our own operations? And then how do we use it to be more predictive in healthcare? So as I think about data, I'll give you a couple of just kind of quick examples on maybe the first one, and I know we'll probably get into a couple of the others. But, the consumer journey, I want to start with that, because I think, as we were sharing a little bit backstage, I think it's important for all of us to either be a patient, a caregiver, or go back into the system to remind ourselves that even though we work in this industry every single day, how difficult it is at times to navigate that system. And as part of that, I've had that opportunity through my family to be participant as a caregiver in the system. And it reminds me, again, how do we connect the pieces? And one of the areas that we spend a lot of energy on at Elevance Health is something called concierge care. And that sounds pretty ubiquitous, right? It sounds pretty simple. It's kind of how we think about things in the rest of our lives. But in healthcare, it's hard. And so what we've built is basically using AI, using generative technology, and trying to understand the consumer, providing them with the tools, an app and a way to log their healthcare data, be able to answer very specific questions, but importantly, not just about the consumer, but to connect them to care teams, connect them to our clinicians who can also see what's happening in their lives. And then they can take it full scale, both from understanding their benefits, because about 30% of the questions we get still are about, how does my health insurance work? What are my benefits? How do I use them? Those are pretty straightforward, simple questions, but when you're going through something, you want to understand that. To who's the best provider? How do I match that personally with someone that's going to be good for me and right for me? So that's embedded in this concierge tool, and I think it's particularly important. And then the care team, instead of having to call you and reach out or send you a letter, should be able to see that data with your permission and be able to engage and look at things that are happening in your life and provide opportunities for either at-home care from a discharge. So I look at that as a great opportunity where we're able to be much more predictive and proactive. And we've seen some pretty good results. Emergency room visits are down pretty significantly in our patients who are enrolled in oncology care. Our diabetics have seen an improvement in their A1C results, and so we're able to identify signs and intervene in depression earlier. So I think there's some really promising things, and that's an example of sort of the consumer and the clinician coming together and trying to make this journey a lot simpler than it is.
So there's just a ton to unpack.
There is a lot
there. I at least find some important things to dive into. First off, on the consumer piece of it, there's a technology piece, but there's also, I think, underlying both of those, this question of trust. So maybe we can try to go into each of these. I'm really struck in this conversation and in our previous conversation backstage. You talk so much in consumer terms, and I think you're not doing that just because we're at the Consumer Electronics Show. I think that's really who you are, and that's really where you are taking Elevance. So say a little bit more about this idea of being a consumer-facing, a consumer-oriented company.
Yeah, I think part of our evolution, I just go back to when I started with our purpose and started with, trying to be a trusted partner. We have to serve individuals. We have to help support them in a very complicated healthcare journey. So we actually look at three constituents I think are really important. One is the consumer, the individual that buys our products, that are part of the healthcare system. The second is the care provider, because they in the healthcare are intimately involved in what you need healthcare. And then the third is community. And for us, community is really important because the health, we often say you're only as healthy as the community in which you live, and we really saw that during COVID. So as we think about the consumer, I think it's really important. Again, it's about simplification and personalization. And that's an area that healthcare has historically struggled with. So a lot of what we're doing and developing is to do that. And I think that's where AI is great. AI has a huge opportunity for us through chatbots and other things to answer questions in a very personal way. When you call, just like when you call any other any other service you have, that we know who you are, we know what your history is, we know what is important to you, and then we can channel you to the right resources. So that's important. But as you and I were talking about backstage, I actually think, as encouraging and as exciting as technology is, particularly AI, it's only going to move at the speed of trust in healthcare. And that's really important. And so what do I mean by that? Healthcare is, because it's so personal and because you need to be right, and it does need to be responsible, and we know there's already bias in things, we see that in some of the data, that we have to be incredibly right about doing it. And we've built a responsible AI model that we started long before we started to do this at scale. And it really gets back to sort of 5 core principles. One, it's got to be transparent. Everybody's got to know what the inputs are. We've got to make sure that it's equitable, that for communities that we know there are disparities already based on human behavior, that we're taking account of that, and we have a group that looks at that as well. It's got to be safe. In healthcare, your data's got to be safe. It's got to be secure. It can't be all around. The people using it have to be accountable. That's another, I think, a really important key, that we're accountable for the outcomes, because we can't have things go wrong. We can't have hallucinations. We have to have clinicians still checking this work. And again, we have to have it documented, and we have to test it. And I think one of the things that we're really looking at a lot is testing these models, making sure they're working as we thought. And I think that's really important for trust. And the last thing I would say, and we were talking a little bit about that, which I'm really excited about, is I think we have to get our own employees and everyone in the system to trust it, along with consumers. And we're trying to do that, and we call it democratizing AI, and we use with our associates an opportunity to work on fabric inside of the company. So they test it, they get comfortable, they understand it, but it's within, again, a very controlled environment. So we're careful that it doesn't have an adverse impact on patients and others.
Well, just from the vantage point of all of us at Microsoft, it's been really interesting and impressive just to watch the deep experimentation that you're doing and doing so with care. Before we get into the technology piece, the consumer piece, I think that I was struck also about how personal this is, because you yourself, of course, are a consumer of healthcare, and I don't want to tease out anything that's overly private, but you take this all very personally, don't you?
I do. I was sharing with Peter backstage, just being a caregiver in my own family, I've had to go into the healthcare system, and I'm a very knowledgeable healthcare consumer, and obviously the company I run, and I found the discontinuities to be troubling, and as an incredibly experienced healthcare user, consumer, someone who is trying to simplify it. So it really reminds me, and as I started before, I think it's important for all of us to go to the reality of what you're doing. And the one thing I also wanted to share on this is partnerships are really important. I think in a lot of industries, we always talk about partnerships. In healthcare, it's an ecosystem. And making sure that ecosystem is connected. So when things are done outside of the ecosystem, that's where I don't think it's as impactful. If they're done to the side, they're not integrated with the core delivery, the core payment mechanisms, the whole way the system works. And that's particularly important. And I think, again, that's where you start to build trust with your trading partners, with all the people who participate in the healthcare system. And I think that's really important. And I'll just give you another real quick example. We are, access is another issue in healthcare, and talk a little bit about virtual care, access to the internet. We're doing a partnership with the sub-providers in Samsung to roll out in our Medicaid population to individuals that we know do not have internet access right now and do not have access to some of the virtual care applications. And so giving them unlimited text and talk, and then educating them on how they can use that for healthcare, because we know they have medical needs. And again, that's a partnership that you wouldn't think of normally. It's outside of healthcare per se, but I think there's a big opportunity to make that digital divide smaller across populations, and that's a great example of getting more people into the system to use healthcare more efficiently.
All right, so it's consumer, but it's also the electronics show, so let's get a little bit nerdy here. And of course, there's just a ton of evolution in the technology, and at least from where I'm sitting, my whole research division is consumed with generative AI and what's going on there, but that's not the only thing happening. So, what is your take on all of this? It certainly appears from the outside, looking in Elevance, that the same thing is happening in your organization, that there is sort of a rethink of all the fundamental technology assumptions. But what's the reality here?
Yeah, no, I think there is a rethink, but I think it starts with culture. We start with trust. Then it goes to culture, and I think the reason we're trying to democratize this is because I think your own associates and those you work with have to have the trust as well. And you have to have a culture of not just putting technology to solve a problem, but fundamentally, and I think I heard Pat say this, transform your entire business model. Beyond, you got to think about the art of the possible here. And if you're just doing this incrementally, which I think we have historically done a lot of very incremental things, then I don't think it works. And so, as I think about the buckets, we talked a lot about consumer. There's a huge opportunity inside of our enterprise and inside of the business of healthcare to use AI and other technology to simplify. And great examples. We have thousands and thousands of pages of policy documents, claim rules, that we have an opportunity to simplify those and get those in the hands of clinicians very quickly, and that's something we've done. And it's great also for the care practitioners, because they don't need to be spending their time there. They need to be spending their time in clinical. And we've been working with the EMR vendors to do that. So a great example, we had over 157 million clinical records transferred to us for about 27 million patients last year. Great example. I don't need faxes, and I laughed about this, but I still get faxes. In this day and age, we still get faxes. We're trying to eliminate that. So it's about workflow change, and it's about integrating this, and then being able to use that information to simplify the process. And those are just very, I think, practical ways that the business part of healthcare needs to improve.
Tell us the truth. Do you have a fax machine in your office?
I do not have one. I have a printer that could fax, but I don't have a fax machine.
So, if I could just stay on generative AI, you mentioned the problems with hallucinations. There's also issues with bias. And that seems to hinge on the trust issue, because there will be a fear that people will have that, oh, my claims might get denied because of some biased AI. And so what's your approach there?
Yeah, so that's an area that we are incredibly cautious about. In terms of setting the responsible AI framework that I said, nothing goes into production without complete and detailed testing and documentation. And honestly, I would say on the claims rule engine, we still have humans making the final decision. So it's human-centered design on it. Same thing with clinical. No AI is making the clinical decision. So what it is doing really in the early stages is it is taking all of the policies, all of the latest data, all of the information, and providing recommendations and information for the clinician and the claim processor to do that better. And on the claim side, it's really good because we get a lot of bad data in. So we can get that data electronically, and we can get that with the right fields filled in, then we have a huge opportunity to pay it right and stop the back and forth that goes on. So I think the early stages of that are huge amounts of improvement. That 10x kind of improvement is there, and we're seeing 20 to 25% improvement in productivity already because of that. So we need to get that at scale. I mean, we operate at giant scale, and so we want to make sure that we roll that out. And another area that I would point to, again, probably less sexy than some of the things we talk about, but it's provider data. So all of you go on and try to pick a care provider that's part of a network, is part of your insurance program, or you're trying to find someone who matches your preference. So making sure that data is clean and right is really important. And we spend a lot of energy making sure that, and then constantly updating that through AI and other means, and also being able to personalize it. So when you want someone in a certain area that's a high-performing provider with certain outcomes, certain availability, then we can personalize that to you as opposed to you trying to find that. So I think those are less, out there kind of things and very practical applications for consumers and care providers to improve just the working environment.
Yeah, it's really interesting. One of the conversations we've had with some of your technical staff, while the generative AI models do exhibit biases, they are also surprisingly effective at reviewing and spotting biases and biased decisions made by others, whether AI or human. And so the potential to have it as another tool in the arsenal to, let's say, look at data sets and see if there are biases or to spot them or look at decisions,
right?
I think has been one of the more interesting things that I know there's some good experimentation going on.
Yeah, and I also think it's an ability to add new data sets that we haven't historically captured even in the EMR. So things around social drivers, food, healthy food, prescriptions for that, other pieces of people's lives that drive depression or drive, a lack of compliance with their current protocols. And I think that's beginning to open up, and I think that's a huge opportunity. And then for us, we use it to then connect people to those social services.